morning, everybody. So beautiful Saturday morning today. Kind of cold, but beautiful day. Sunny, fall colors, all of that. Pretty. Leaving work as usual. And we were just kind of like being briefed on the COVID situation and kind of like bracing ourselves for the next couple of months and, you know, winter and such. And every time it gets worse, I think healthcare professionals, we've gotten to a point that we're either traumatized by the level of bad news and situations we're dealing with, or worse, at least on my view, on my purview, we're becoming desensitized. And the minute you reach that point in healthcare, you're not helping anybody. So the new information, right, as I'm sure a lot of you know, there's a huge surge in COVID cases throughout the nation. And I think people want to hang on to the idea and the conspiracy theories and the silver linings and try to act like this is no big deal. But it is. The problem is not the amount of positive cases that we get. Like yesterday, we set up a record with over 100,000 something positive cases. And that's expected. I mean, it is a virus. It is an easily transmitting virus. And, you know, we knew this type of spread was going to be like big, and it was going to happen. But the idea was to, you know, test, contact trace, contain, and the United States, because of how politicized everything became, never got to that point. So it's been running rampant ever since. So the problem we're facing right now is it's not the amount of positive cases. People always focus on that. And yes, it is true. We're showing cases because we're testing more, which is not a negative. It should be a positive. Because if we don't identify those cases, then they're running rampant through the community, and we won't know until people wind up in the hospital, which is the whole point of quarantine and isolation. So the problem is that out of all those positive cases, we're seeing, out of every 5 cases, we're seeing at least 2 patients wind up in the hospital. That's a big problem, especially in the middle of flu season. If you're in the Pennsylvania area, we have a pretty nasty strep throat, kind of like infestation in the area, an outbreak. So upper respiratory infections, which are typical from this season because of mold, because of humidity, the changing weather. And our hospitals and medical staff, we're getting worn out. That's the bottom line. And you can't draw water from an empty well. And that's where we're at right now. I love when the administration tries to sell their little positive outtake and the little silver lining. It's like, oh, we got the vaccine. Not helping anybody, because we don't even have enough doses, and everybody that's in this business, sad to say it is a business, knows that whenever there's a pandemic and this type of issue, when you get a vaccine, it goes to first responders first, which it should, because you want the people that can help to be healthy and immune. So, but we're not even there yet. So healthcare workers across the nation, hey Uncle George, God bless, miss you, love you. So those of us that work in healthcare, we're coming to work every day, we are getting sick, trying to protect everybody else, and even the hospitals. Like, we have been going to crazy lengths trying to accommodate to help our communities. I mean, we have hospitals that have shut down entire wings and dedicated them to COVID because that's the amount of patients we're getting. And people do not understand how serious this can become. Case in point, Arizona. They are overwhelmed. They are getting to the point where they're going to have to ration the amount of beds that they dedicate in an ICU. Now, people listen to ICU anymore, and right away they think COVID and think everything is cool and dandy. So if you're rationing beds in ICU, what it means is the following. If you or a loved one are having a heart attack, or you're having a stroke, or you got into a motor vehicle accident, or some weird accident altogether, and you need intensive care, intensive medical care, critical care, and I have 11 beds in my ICU, and 9 of them are full with COVID, I only have space for 2 more critical patients. You wouldn't want to be that person that I say, hey, yeah, we don't have a bed for you. We're going to have to transfer your dad to the closest hospital, which is 2 hours away from here. That's where we're at, people. Doctors are getting sick and dying. Nurses are getting sick and dying. Respiratory therapists, front desk, environmental services, good people that are in this business to help, are going day in, day out without knowing if they're going to catch it, if they're going to come home and give it to somebody they love. And on top of that, having to go through situations that we know it comes with the territory, but that doesn't make it any easier. You know, it is not easy to be on the phone and tell a patient, no, you cannot visit your father. No, yes, I understand your child, it's a minor, but no, you cannot be in his room. Or, you know, we're gonna put your wife in a ventilator. Would you like to look into this phone and talk to her for a little bit before we put her in a ventilator? You know, like, we're going on almost a year on this situation, and I think people, the political aspect of it took away from how serious this is, and people are so tired and fatigued of the media, of the news, that they forgot the threat. And we're about to get hit big time, and I cannot underline that enough. I was never a person to be doing this stuff, doing videos and being on FaceTime and YouTube and anything like that. That is not my style. I would much rather be behind the scenes. But somebody has to be the voice for those that can advocate, and for those that want to be ignorant and think that ignorance is bliss. We're about to get hit worse than that we've seen in the last couple of months, in the last 9 months. We're never going to get back to normal, nor should we get back to what normal was, because obviously that's what landed us here. But people need to brace themselves. You know, like, you need to have an understanding of what is going on and how we are responding. We are running on thin on resources, and I think I've said this in previous videos. I could have 1,000 ventilators, 1,000 beds in storage in my hospital, all of that. If I don't have the personnel, I'm not helping anybody, and that's exactly where we're at. Our EMS and EMT people across the states are being told, if you cannot get a pulse at the scene, do not bring them to the hospital. And I wish people would understand that and understand what that entails. Because you could have somebody that has a syncope or has a heart attack, and for a small amount of time, you can't get a pulse, but you can prop them in the ambulance and put in life-saving measures and get that person back. That is not an option anymore. EMT comes to the scene, they can't get a pulse, that's it. That person is not coming to the hospital, or the emergency room for that matter. They will be met with the medical examiner, and they will be declared death on arrival, and that's the outcome. Emergency rooms protocols, same thing. ICU protocols, same thing. Those of you that know about healthcare know that usually when you are putting in place life-saving measures, you do a couple of rounds of cardiorespiratory procedures and such. So usually you will, put the person in a ventilator or oxygen and such. You would do CPR. You'll push epi and give another round of CPR, shock, epi. So sometimes we do that twice, 3 rounds to see if we can get that person back. We're not doing that anymore. So not only are we losing lives because of the virus, we are losing lives because the amount of cases, the overflow, does not allow us to treat effectively any other emergency. For that matter, we do not have the personnel. We don't have the manpower. And when you have the professionals getting sick themselves or having to quarantine because they were exposed, or yet having to go to work being positive because they don't have symptoms, so they're like, well, we need you, so just show up. That's a problem. It's a crisis, and that's where we're at. And it's an embarrassment that a developed nation, the most powerful nation in the world, is going through this. But it's not going to change until people stop being ignorant and stop relating healthcare with which side of the fence I'm on, and making social distancing and masks and quarantines a human rights issue. Where are the rights of the people that are vulnerable? Where are my rights as a healthcare worker? Like every time when I'm doing intake and health call and dispatch, and I have somebody, I need to get tested for COVID right now. Why? Did you get exposed at work? Do you have symptoms? No, I went to a birthday party with a friend and I heard there's 4 people that were there that are positive. What is your stupid ass doing in a birthday party? And I'm sorry if anybody gets offended, but that's the point. Get offended. Get upset, because that's the reality. We need to deal with the reality. You cannot be ignorant anymore. This is not, I live in America and I'm going to do whatever the F I want. This is we are all humans. All lives are precious. My life is precious, and we need to start taking care of it. This is beyond the point of I haven't seen my family, I haven't seen my parents. We're past that point. This is about saving lives. And I'm sorry, I have no empathy for anybody if you get COVID positive because you decided to go camping with a bunch of friends, or you decided to go to your aunts and uncles barbecue because it was only going to be family. They've been telling you, stay outside. Try to remain within the circle of people that you live on a daily basis. If you're going to have a gathering, try to make it 10 people or less. Wear a mask, indoors, outdoors, anywhere where you're going to be closer than 6 feet to any human being. And we refuse to listen. No, we have to make it about ourselves, about nobody's going to tell me how to lead my life. Nobody's going to tell me what. So, I don't know. It's just getting to the point that again, my empathy, it's just not there anymore. Because I can get infected because somebody was ignorant enough and decided they were gonna go out, or just because, and now I'm sick and in danger, and my family. And with the holidays coming by, you know, I get it. I get it. This hasn't been a easy pill to swallow for anybody. But when people make stupid decisions and they get the consequence, I can't feel bad for them. I really can't. Now, it breaks my heart that we're going on 9 months and I can't see my nephew, for example. Now, that would have been very, very different if people would have listened to the professionals from the door and would have followed instructions rather than listen to the fucking idiot that refuses to leave the White House after he clearly lost. And I mean, I'm sorry, everybody thinks he doesn't want to leave because the election was rigged, this, that, and the other. The motherfucker doesn't want to leave because he's a criminal. And he knows, he hasn't been able to figure out if he can get away with a full pardon as a president. So he knows that when his time is up, people are coming. There is mad money out there that this idiot owes. Not only to Uncle Sam either. He has some hefty debt with some ugly people. So when his reign, because that's what it's been this last 4 years, when his dictatorship is over, he's going to be out. And we're going to be left with this mess. And all the lives we've lost. If we would have seen these numbers of lives lost in any other circumstance, we would have been sending our military to try and fix the issue. If this was another country. But we are so politicized and so divided and so ignorant, because it's just, that's the only word I can think of, that we have become like, no, I believe my president, he is right, he barely passed university, but I'm gonna listen to him rather than the scientists that have been doing this for the last 30 years. And fuck the mask, fuck the social distance. If I'm gonna go to the bar, I'm gonna go to the bar. So when you can't have Thanksgiving this year, or your table is missing 4 people because they passed away from COVID, or when you can't have Christmas, go look in the mirror, point the finger at the person in the mirror, because it's all your fault. It's all of our fault. Because we refused to listen, because it became about criticizing and arguing and protesting, when we all should have been just for a couple of weeks at home, only leaving for the necessities and calling it a day, and wearing a stupid piece of clothing, mask, whenever we were outside or had an interaction. So yeah, this year, when you cannot have Thanksgiving or Christmas or New Year, and you start listening to the amount of people that we are going to lose, because we are probably going to lose another 200,000 to 300,000 optimistically, you only have one person to blame, and that's yourself. Because the United States has acted like an angry toddler, and we just threw a tantrum and said, we're not going to do this, I don't have to listen to you, and we're here. So those of you, if you care about yourself and your loved ones, please, 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 please stay home. if you have to, if you're an essential worker or you have to be out there, mask, wash your hands, practice hygiene. Please, people. Just saying. Sorry, Uncle George. I know. I have a potty mouth. Can't help it. I'll try to get better. Have a good day, everybody. God bless.